Hello everyone and welcome to our Career Pathways presentation. We really hope that you guys enjoyed this video of us explaining the amazing careers that we got to interview and that you guys learned something out of all of this, and we can't wait to also see your guys' presentations. Thank you. So our career pathway topic is the education, psychology, and social studies. So these jobs are more geared toward the industry of helping people, whether that be a teacher, a doctor, maybe a therapist, which are some of the careers that we're going to be talking about today to give you a little sneak peek. But more specifically, the communication skills that we're going to be talking about is nonverbal communication, listening skills, and team communication, all of which are very important attributes to have in our everyday lives. And we really hope that you guys will learn something from this presentation and apply it to your own life, not only in the workforce, but just in how you treat your friends, family, classmates, and in every aspect of your life, and that your communication skills will grow deeper and deeper.
Hello everyone, I'm also another member of the Educational Psychology and Social Sciences team. I hope you guys enjoyed this presentation as I'm going to present some facts about being a marriage and family therapist and teaching you how to be a great listener. I hope you guys enjoy this presentation. Hello everyone, have you heard of an old saying, listen to understand, do not listen to respond? It's actually a very great listening skill that each and every one of us should adapt each and every day of our lives. At home, at school, at work, there are pros to it. It betters your relationship. You get clarity. You receive information, and you also communicate respect to the other person speaking to you. So having listening skills is something that we should all have, not only as a family therapist, but also as a doctor, as a teacher, as a singer, most definitely, as a musician, as an actor, as an actress. No matter what your profession is, your listening skills should always be on its best behavior, because that's how we learn and that's how we elevate, through listening. Hello everyone. As a marriage and family therapist, we focus on the relationships surrounding of the client and how those relationships affect their mental health. We really just focus on how they can reconnect to people, how to mend their relationships with people, regardless if it's just a friend or a sister, a brother, a mother, or a boyfriend, or even your husband. But that is what we really focus on. And as a marriage and family therapist, it's important to have great listening skills, because that's how we show our client that they can trust us and that we feel them and we understand them, and we can give them ways to help them and they can be open to it. I hope you all was listening to understand, not listening to respond. And you guys have gained a lot of information on how to be the best family therapist and also how to be a great listener. I hope you all was listening to understand. Now, to put you up to the test to see if you're listening, we are going to play the directions test. Whatever I tell you to do, wherever you are, behind the screen, in your home, in your living room, in your car, just follow along. Okay? You ready? I just want you guys to follow whatever I tell you to do. Do as I say or say as I do. All right? Touch your nose. Touch your head. Touch your chin. Touch your ear. Nod your head. Look up. Look to the side. Look to the other side. Now say your name. Ann Rose. My question for you, what was the first thing I asked you to do? If you remember, type it down low on the right side of the chat box and let me know what was the first thing I asked you to do. I'm going to give you guys some time. If you said the first thing I asked you to do was to do as I say and say as I do, then you're correct. If you said the first thing I told you to do was touch your nose, unfortunately, you were not listening to understand, you were listening to respond.
Have you ever wondered what it means to be a psychiatrist? Well, a psychiatrist is a medical doctor who focuses on the mental and physical psychological problems that a patient may be enduring. According to an article on nonverbal communication and psychotherapy, the main objective of a psychiatrist is to examine the mental health and well-being. This meaning that they have to examine and figure out if a patient is dealing with bipolar, schizophrenia, depression, anxiety, and understanding the overall well-being through verbal and nonverbal communications. More specifically, I have studied the nonverbal cues and the importance of them within the psychiatric field of work. We just mentioned that nonverbal cues are so important in the psychiatric field of work and during the examination of a patient. This is my communication skill that I focus on during this line of work. Nonverbals help the psychiatrist give the patient a correct diagnosis so that they can get onto the road of recovery. Now, psychiatrists not only have to learn how to read these clues, but also in the place that they are. They have to understand where they are, who they're dealing with, and the circumstances that they have gone through. They also have to learn how to read these nonverbal cues. Nonverbal cues come in many different shapes and forms. It can be the body posture of someone. It could be a look in their eye. It could be a laugh. It could be a rapidly tapping foot. It could be a glance away at a certain question, a crossing of the arms. The list goes on, and it changes with each different patient depending on what they are going through. To understand more and more about nonverbal cues, there is something called the thin slice. So you might be asking yourself, what is a thin slice? Because I know when I first read that, I had absolutely no idea what it meant. Well, a thin slice is defined as a brief excerpt of expressive behavior from a behavioral stream. Now, what does that mean? Well, that basically means nonverbal cues given to the psychiatrist during the evaluation. So these cues could give off that a person is depressed. These cues could give off that the person is dealing with schizophrenia or bipolar. It's really just how you explain the different expressive behaviors that go into the evaluation. When a patient is asked a specific question, do they flinch? Do they look away? Do they cross their arms? These things give way into what they are really hiding. Verbal cues are so important, but nonverbal cues almost speak louder than the verbal. The verbal is what they are portraying that they want to be. The nonverbal portrays more who they really are. And sometimes you can't hide those nonverbal cues. You can't stop the looking away momentarily during a question that makes a patient uncomfortable. So you have to look for these thin slices, and that is a job of the psychiatrist in giving a successful evaluation and diagnosis. Because if a psychiatrist gives a false diagnosis, well, that's not going to help the patient in a road to recovery. So they have to look at these thin slices. So just to reiterate on the key points that we focus on today, psychiatrists are medical doctors who focus on the patient's mental health. More specifically, they have to be informed of the nonverbal cues, how to read them in the situation they are in, and how to actually get to the depth of how the patient is feeling and what the patient is going through. And these can be described as thin slices, how the patient is expressing themselves through these nonverbal cues. All right, guys, last but not least, we're gonna have a little bit of a quiz to see what you guys learned during this part of the presentation. So let's get started. The first question is, what is a thin slice? Is it A, a piece of cake, B, expressive behavior patients give off, or C, when a patient has a thin smile? The answer is B. The next question is a true or false. Nonverbal communication is important in a psychiatric evaluation. True or false? The answer is true. And the last one, also true or false, psychiatrists can only evaluate the patient based off of their verbal cues. Verbal. I really hope that you guys get this one right. It is false. false. That is not true. It is nonverbal and verbal. It is a healthy balance of the two, and figuring out how to read them both and then give a proper diagnosis for the patient. Thank you guys.